These are the contents of our PowerPoint presentation today. We will be starting with the introduction, problem statement, objective, then moving on to the proposed methodology, prototype visualization, flowchart, and finally ending with the future scope and the conclusion. India has always faced the challenge of drug abuse. The major factor that strengthens drug abuse in India is the illegal use of narcotic drugs for recreational purposes. In a populous country like India, where medicines are being produced in a large quantity every day, it is a difficult and also tedious task to keep track of narcotic medications from the manufacturers to the distributors and then to the local pharmacies and at last to the patients and customers. It is in this scenario that our problem statement arises. A chemist is only allowed to dispense prescription drugs upon receiving a prescription from a doctor and after verifying the completeness, authenticity, and legality of the prescription that contains the requisite details like the name of the doctor, his or her address, registration number, along with the name of the drugs, their potency, dosage, and the duration for which they are to be supplied. It is a requirement under the NDPS Act of the Government of India that controls these narcotic drugs and their ingredients. The problem statement demands us to find out a solution that should enable tracking the supply chain of these prescription drugs from the manufacturer to the end user. And in this scenario, we come up with our proposed methodology that would follow. The main objective of our proposed solution is to develop a centralized supervisory system that would track the supply chain of the narcotic drugs right from the manufacturer till it reaches an end users that could be the hospitals or the required patients with a proper and valid certification. Basically, it can be stated as a transmission control system for narcotic drugs.
Our proposed methodology is divided into three layers. The layer 1 includes the production and the packaging of the medicines by the manufacturer, and the manufacturer will enter the details of the medicines and dispatch it. Upon being received by the wholesaler, the wholesaler will check the data entered by the manufacturer, and if it is found to be discrepant, then it would be reported immediately to our system. Then moving on to the layer 2, if and only if the data matches, the wholesaler is now allowed to forward the batches among the hospitals or the local pharmacist. Here also the same check will be there as it is done in the layer 1, and if the data is found to be discrepant by any of the pharmacists or the local hospitals, they will immediately report it to our system. Moving on to the layer 3, which is also one of the most crucial layer of our proposed methodology. Here we will be checking the authenticity of the prescription provided by a patient by scanning its QR code or by validating the different parameters of a valid prescription. And if the prescription is found to be authenticate, then only the medicine will be sold. And if it's found fake, then it will be reported immediately. Presenting to you Avaniyantra, our app. The name Avaniyantra comes from two Sanskrit words. Ava comes from the Sanskrit word Abmohan, meaning narcotic, and Niyantra comes from the Sanskrit word Niyantran, meaning to control. So this is our home page or the landing page of our prototype. This is the sign up and the login page for the users. This is a sample dashboard of a manufacturer. Similar kinds of dashboard are available for the wholesaler and the pharmacist with their different functionalities, and all the functionalities can be controlled through this centralized dashboard only. This is the medication details entry page, which will be available only to the manufacturer who is manufacturing the medicine and entering the details of the medicine. And this is the batch details entry page. The above screenshot shows us the parcel details from where we can send parcel to different user, and this screenshot shows us the parcel received. So this is the entire flowchart of our prototype. First, the medicines are manufactured, then the medicines are being dispatched by the manufacturer, and on receiving by the wholesaler, the data entered by the manufacturer and the wholesaler is checked. If it is found free of discrepancy, then it is moved forward, or else it is reported to our system. Same check is there for the wholesaler and the pharmacist. If it's found discrepant, then report it or else it is moved forward. Now coming to the final stage, here the QR code scan, that is we check the authenticity or the validity of the prescription, and if the prescription is found valid, then the medicines are dispatched or else it is also reported to our system.
So that was our proposed methodology and the visualization of the prototype which we have created based on this methodology. Now here are some of the future scopes which we would try to implement in the future if we are given ample opportunity to proceed. Firstly, we would try to implement a QR code scan to check the validity of the prescription at the end user level. We would also try to implement an alert token generation system to detect and report the missing medicines while in transit. We would also formulate and generate UID system for the registered personnel and to uniquely identify them. For extra security and to maintain the CIA triad, we would also implement a two-factor authentication system. Since we are planning that this app of ours can be used on a large scale, we are also thinking of the development of a mobile app version of the system. And last but not the least, this is an idea that can be developed into a successful business model with proper plan, strategy, and execution. In the end, I would like to say that since there doesn't exist any centralized supervisory system to track the supply chain of the narcotic and the psychoactive drugs from the manufacturer to the end users, our solution is the pioneer in this field, and this would prove beneficial for the government in tackling the issue of drug abuse and drug misplacement in India and thus help India move towards a better future. With this, we have come to the end of our PowerPoint presentation. Hope you have liked our project, and I convey our heartfelt gratitude on behalf of our team for listening to our project. Thank you.